Canada is sending its mobile Ebola lab back to Sierra Leone. A three-person team left yesterday for the West African country. The last Canadian team was pulled out late last month. This was after people at the hotel complex where they were staying were diagnosed with Ebola. It comes as Sierra Leone's latest attempt to control the outbreak draws more criticism. This time, it's from Doctors Without Borders. The aid organization says a proposed countrywide lockdown could spread the disease even further. The group says similar measures have driven patients underground elsewhere. Later this month, Sierra Leone plans to order its citizens to stay confined to areas around their homes for 3 days. It says the move will halt new infections, and it will help health workers track down people infected with the disease. For more on the lockdown, we're joined by Alpha Kanu. He is Sierra Leone's Minister of Information, and he joins us now from Freetown. So, Minister Kanu, what prompted this decision to lock down the entire country for 3 days?
Thank you very much. I think you hit the nail on the head. The prevalence of the disease is rising, and we as a government are worried. And the best way to stem the growth of the prevalence is to lock down the country and reduce movement, and at the same time identify those who have already contacted the disease, because during those 3 days of lockdown, they may have shown some symptoms of the disease, and they'll be identified and removed to treatment centers so that we can look after the rest of the population.
But as you know, Doctors Without Borders says the lockdown will not help and that the disease could spread further as people conceal their cases or patients go underground. What's your response to that?
Well, I don't know what the alternative is. For now, we don't have available adequate testing facilities for us to pick out the people who have contracted the disease easily. The best way to do that is to lock down, which more or less turns the country into a makeshift laboratory, where during those 3 days, anybody who may have contacted the disease before lockdown would have shown some symptoms, and they will be identified by medical workers and groups of youthful volunteers who would be trained in all of the districts and all of the wards in the country to go from house to house to help find these people. And we don't see any reason why people want to go underground. For now, the danger is that people are afraid that they may not get treatment when they go out to present themselves. But we now know that the disease does have a cure if you represent yourselves early. And that is what we are banking on. We're giving them hope. We're telling them that the disease can be cured provided you go into a treatment center early. And that's what we're trying to do.
Now, in Liberia, the government locked down a neighborhood in Monrovia last month, which resulted in riots. Are you worried about there being riots in Sierra Leone?
The situation in Monrovia was unfortunate. But I think the fact that only a small section of the city of Monrovia was locked down while the rest of the people the country were allowed to move around sort of gave a feeling of those who were in the lockdown areas, a feeling of being discriminated against. Our own approach in Sierra Leone is to lock down the whole country, which means that everybody from the president down to the cleaner in the street are going to be subjected to the same rules at the same time. So nobody will have preferential treatment. They will know that we are doing this purely to find out a way of weeding out the sick away from the healthy and then find a cure for them. I don't think that should create that kind of problem.
Minister, we appreciate you taking the time. Thank you. That is Alpha Kanu, is Sierra Leone's Minister of Information, speaking to us from Freetown. We're back with more right after this.